I'm about to tell you something that could save your life, and it's hiding in plain sight on every blood pressure reading you've ever had. Two numbers, one over the other. You've seen them hundreds of times. Your doctor mentions them at every visit. But here's what nobody has explained to you clearly. One of these numbers is significantly more dangerous than the other, especially after age 60. And the number that's killing more seniors might not be the one you're watching. In my decade of experience, I've seen the devastating effects of uncontrolled blood pressure firsthand. The strokes that steal independence, the heart attacks that change everything in an instant, and the families forever altered because someone focused on the wrong number. What I'm about to share with you is based on decades of research involving millions of patients. This isn't theory. This is proven, life or death information that every single person over 60 needs to understand. By the end of this video, you'll know exactly which number poses the greatest threat to your heart, your brain, and your life. You'll understand why this number becomes more dangerous as you age. And most importantly, you'll know what to do about it starting today. This could be the most important 20 minutes you spend this year, so stay with me because the answer might shock you. Let me tell you about two patients. Their stories will help you understand what I'm about to reveal. The first was Margaret, 73 years old. She came to see me for a routine evaluation, and her blood pressure that day was 165 over 70. Now Margaret was absolutely thrilled. She told me, "Doctor, my bottom number is perfect. I've been working so hard to keep it under 80, and look, it's only 70. I know my top number is a little high, but my daughter read online that as long as the bottom number is good, I shouldn't worry too much." I wish I could tell you that what Margaret believed was correct, but 6 months later, Margaret had a massive stroke. The left side of her body was paralyzed. Her speech was slurred. The independent, vibrant woman who'd walked into my office was now dependent on her daughter for every basic need, from getting dressed to eating meals. The cause? Years of elevated systolic pressure, that top number, that had been silently damaging the arteries in her brain while everyone celebrated her excellent diastolic number. The second patient was Robert, 68 years old. His reading was 128 over 95. Robert came in absolutely terrified. He told me, "Doctor, my bottom number has been creeping up for years. I read that diastolic pressure is the real killer, the one that shows your heart is working too hard all the time. I'm convinced I'm going to have a heart attack any day now." I ran a complete cardiac workup on Robert, stress test, echocardiogram, the works. His heart was fine. His arteries showed minimal issues. Yes, we needed to address that elevated diastolic number, but his actual risk was nowhere near what he feared. We made some lifestyle adjustments, monitored him closely, and Robert is doing great today. Two patients, two different patterns, completely different outcomes. And this brings us to the critical question you came here to answer. Which number is more dangerous, systolic or diastolic? But before I give you the answer, I need you to understand something crucial. This question doesn't have the same answer for everyone. If you're 30 years old, the answer is different than if you're 70 years old. Your age fundamentally changes which number poses the greater threat. And since my audience is primarily people over 60, I'm going to focus on what the research shows for your age group specifically, because this is where the answer becomes crystal clear and where understanding it can literally save your life. Let's start with the basics, because I need you to truly understand what these two numbers represent. When your doctor or nurse wraps that cuff around your arm and it squeezes tight, it's measuring the pressure of blood pushing against your artery walls. But blood pressure isn't constant. It's pulsing with every heartbeat, and that's why you get two numbers. The top number, the systolic pressure, measures the maximum force when your heart contracts and pushes blood out into your arteries. Think of it like a wave crashing against the shore. That's the moment of peak pressure, the surge of force as your heart squeezes. The bottom number, the diastolic pressure, measures the minimum pressure when your heart relaxes between beats. It's the calm between the waves, that steady background pressure that remains even when your heart is resting. So if your reading is 150 over 90, It means the peak pressure when your heart contracts is 150 millimeters of mercury, and the resting pressure between beats is 90. Now, for decades, doctors focused intensely on both numbers. If either one was elevated, you had high blood pressure and needed treatment. In fact, there was a time in medicine when doctors believed diastolic pressure was actually more important. The thinking was that systolic pressure naturally goes up with age, so unless it was extremely high, it wasn't treated aggressively. Diastolic pressure, which represents the heart at rest, was seen as the true reflection of cardiovascular health. But over the past 30 years, as researchers have followed millions of people for decades, tracking who has heart attacks, who has strokes, who dies from cardiovascular disease, a clear pattern has emerged, and it's a pattern that becomes more pronounced the older you get. The research that changed everything came from multiple massive studies. The Framingham Heart Study followed over 5,000 people for decades. The MRFIT study tracked over 300,000 men. Study after study, involving millions of participants, all pointed to the same conclusion. After age 60, systolic blood pressure is a far stronger predictor of cardiovascular events than diastolic pressure. In fact, some studies showed that systolic pressure was 2 to 3 times more predictive of heart attack and stroke risk than diastolic pressure in older adults. But it gets even more interesting. Researchers noticed something peculiar. In many older adults, systolic pressure goes up while diastolic pressure stays normal or even goes down. This creates what we call isolated systolic hypertension. This is exactly what Margaret had, 165/70. That elevated top number with a perfectly normal bottom number. And for years, doctors weren't sure what to do about it. Some thought, well, if diastolic is normal, maybe this isn't really dangerous. Maybe this is just normal aging. We now know that thinking was catastrophically wrong. Isolated systolic hypertension is not benign. It's not just aging. It's a dangerous condition that dramatically increases your risk of heart attack, stroke, heart failure, and kidney disease. Studies have shown that treating isolated systolic hypertension reduces stroke risk by 30 to 40% and heart attack risk by 15 to 25%. Those are massive numbers. We're talking about preventing thousands of deaths and disabilities every single year. So, let me be absolutely clear. If you are over 60 years old, your systolic blood pressure, that top number, is the most dangerous number on your blood pressure reading. This is the number that's most likely to predict whether you'll have a heart attack or stroke. This is the number you need to be watching like a hawk. This is the number that needs to be controlled. Now, does that mean diastolic pressure doesn't matter? No, it absolutely matters, but it matters in a different way. And understanding this nuance is important because it affects how your doctor should treat your blood pressure. Let me explain. For younger people, especially those under age 50, elevated diastolic pressure can be particularly concerning. High diastolic pressure can weaken your body's main artery, the aorta, which is like the main highway that blood travels down from your chest through your abdomen. Over time, consistently high diastolic pressure can weaken a section of the aorta in the abdomen, causing it to bulge. If that diastolic pressure isn't controlled, that bulge can eventually rupture, leading to internal bleeding that can be fatal. The medical term for this life-threatening condition is an abdominal aortic aneurysm. Think of it like blowing up a balloon. As you first begin to blow, it's harder. But as the air continues to expand the balloon, the walls stretch and become thinner and thinner until, if you overfill it, it will eventually burst. This is the same thing that happens with uncontrolled diastolic pressure within the aorta. But here's the key point. Both numbers matter, but for different reasons. High systolic pressure increases your risk for heart attacks, strokes, and permanent kidney damage. High diastolic pressure increases your risk for aortic aneurysms and long-term blood vessel damage. What's changed in medicine is that we no longer dismiss elevated systolic pressure as just normal aging. Both numbers are critical signals, but for people over 60, we actually pay more attention to systolic pressure when trying to lower someone's numbers overall. Now, let me explain the physiology behind this, because when you understand why systolic becomes more dangerous with age, everything makes more sense. Your arteries are not rigid pipes. They're elastic tubes that expand slightly with each heartbeat and then recoil. This elasticity, this ability to stretch and bounce back, serves a crucial function. It absorbs some of that peak pressure from each heartbeat, smoothing out the force and protecting your organs from constant pounding. When you're young, your arteries are flexible. They expand easily with each heartbeat. This keeps your systolic pressure relatively low and your diastolic pressure relatively high, because the arteries are still squeezing back effectively during the resting phase. But as you age, your arteries stiffen. The elastic fibers in the artery walls break down and are replaced with stiffer collagen. Calcium can deposit in the walls. Atherosclerotic plaques develop. Your arteries become less like rubber bands and more like rigid tubes. Now, when your heart contracts and sends that wave of blood into stiff arteries, those arteries can't expand and absorb the pressure. The systolic pressure shoots up. But during the resting phase between beats, those stiff arteries don't recoil as effectively, so the diastolic pressure often stays normal or even drops. This is why isolated systolic hypertension is so common in people over 60. It's a direct result of arterial stiffening. And here's the critical point, that elevated systolic pressure is not just a harmless marker of stiff arteries. It's actively causing damage. Every time your systolic pressure spikes, it's hammering your organs, your brain, your kidneys, your heart, your eyes. The delicate blood vessels in these organs are being injured with every heartbeat. Think of it like waves hitting a seawall. A few big waves don't cause much damage, but thousands of waves, day after day, year after year, will eventually crack that seawall. That's what elevated systolic pressure does to your blood vessels. It creates tiny injuries. Your body tries to repair them, but the repair process leads to more stiffness, more inflammation, more atherosclerosis. It's a vicious cycle. The brain is particularly vulnerable. The small blood vessels that feed your brain tissue can't handle chronic high pressure. They develop microaneurysms, tiny weak spots that can rupture, causing hemorrhagic stroke, or they become narrowed and blocked, causing ischemic stroke. And even if you never have a major stroke, chronic high systolic pressure causes thousands of tiny silent strokes. Microscopic areas of brain tissue die. Over time, this leads to vascular dementia, memory loss, confusion, personality changes. Many cases of what we call Alzheimer's disease are actually vascular dementia from years of uncontrolled systolic hypertension. Your heart suffers too. That hard-working muscle has to generate enormous force to push blood into stiff, high-pressure arteries. Over time, the heart muscle thickens, trying to keep up with the demand. This thickening, called left ventricular hypertrophy, is dangerous. A thickened heart is a stiffer heart. It doesn't fill properly. It doesn't pump efficiently. This is how you develop heart failure, not from a single heart attack, but from years of your heart working overtime against elevated systolic pressure. Your kidneys contain millions of tiny filtering units, each supplied by delicate blood vessels. Elevated systolic pressure damages these vessels, causing kidney disease. Once your kidneys start failing, they can't regulate blood pressure properly anymore, which makes hypertension worse, which damages the kidneys more. Another vicious cycle that can end in dialysis. Now, here's something important that many people miss. Even if your blood pressure is controlled with medication, your risk is still higher than someone who never needed blood pressure medication to begin with. One large study found that a 30-year-old with high blood pressure has a 63% chance of developing coronary artery disease at some point in their life, versus just 46% for someone the same age who doesn't have high blood pressure. What this means is that medications, when needed, absolutely help and save lives, but they Don't completely erase the risk. That's why it's so important to view medication as one tool in your arsenal while you make the lifestyle changes necessary to reduce your blood pressure naturally and protect your cardiovascular system long term. So, what are the current guidelines? What numbers should you be aiming for? The American College of Cardiology and the American Heart Association updated their guidelines in 2017. They lowered the definition of hypertension to 130 over 80. That means if your systolic is 130 or higher, or your diastolic is 80 or higher, you have hypertension. For most people over 65, the target is to get systolic pressure below 130. Some guidelines even suggest that for very healthy older adults, targets below 120 might be beneficial, based on the SPRINT trial, which showed dramatic reductions in heart attack, stroke, and death with intensive systolic control. However, for frail elderly individuals, especially those over 80 with multiple medical conditions, slightly higher targets may be more appropriate to avoid complications from overly aggressive treatment. The key point is this: if your systolic pressure is above 130, especially if it's above 140, you need to take action. You need to work with your doctor to bring it down. And if your doctor is dismissing an elevated systolic pressure simply because your diastolic is normal, you need to have a serious conversation. Show them the research. Ask specifically about treating your isolated systolic hypertension. Your life may depend on it. Now, what about treatment? How do you get that systolic number down? The answer involves both lifestyle changes and, often, medication. Let me walk you through both because you need a complete strategy. Lifestyle changes are foundational and they work for everyone regardless of where your numbers are right now. First, sodium restriction. This is massive for blood pressure control, especially systolic pressure. Most Americans consume over 3,400 milligrams of sodium daily. The recommendation for people with hypertension is 1,500 to 2,000 milligrams maximum. Reducing sodium can lower systolic pressure by 5 to 10 points. That's substantial. Cut out processed foods, don't add salt at the table, and read labels obsessively. This alone can make medications more effective or, in some cases, reduce the need for them. Second, weight loss if you're overweight. For every kilogram, that's about 2.2 pounds, you lose, you can expect systolic pressure to drop by about 1 point. Lose 10 pounds, drop 10 points. Combined with sodium restriction, you're looking at potentially 15 to 20 points of systolic reduction from lifestyle changes alone. Third, regular aerobic exercise. Walking, swimming, cycling, anything that gets your heart rate up moderately for 30 minutes most days of the week. Exercise has multiple beneficial effects on blood pressure, including improving arterial elasticity over time. It's not just about weight loss. The exercise itself is medicine. Fourth, limit alcohol. If you drink, keep it moderate. No more than 2 drinks per day for men or 1 for women. More than this can significantly raise blood pressure, particularly systolic pressure. Fifth, stress management. Chronic stress elevates cortisol and adrenaline, both of which raise blood pressure. Meditation, yoga, deep breathing exercises. Whatever works for you to calm your nervous system, do it daily. And sixth, get adequate sleep. You need 7 to 9 hours of quality sleep each night. Not enough sleep can keep your blood pressure elevated, even if you're doing everything else correctly. But here's the reality. For most people over 60, with systolic pressures above 140 or 150, lifestyle changes alone won't be enough. Medication is almost always necessary. And this is where I need to be very clear. Blood pressure medication is not a failure. It's not a sign that you didn't try hard enough. For older adults with stiff arteries and elevated systolic pressure, medication is often life-saving. There are multiple classes of blood pressure medications: diuretics, ACE inhibitors, ARBs, calcium channel blockers, beta blockers. Each works differently, and many people need 2 or 3 medications to control systolic pressure adequately. This is normal. This is not excessive. Your doctor will choose medications based on your other medical conditions. If you have diabetes, certain medications protect your kidneys. If you have heart failure, others help your heart function better. The important thing is finding the right combination that controls your systolic pressure without causing intolerable side effects. If one medication makes you dizzy, or causes a persistent cough, or creates any problem, tell your doctor. Don't just stop taking it. Ask about alternatives. There are so many options available that almost everyone can find a regimen that works. And here's something critical. Once you start medication, you can't just check your blood pressure at the doctor's office every 6 months and assume you're fine. You need to monitor at home. Get a good quality home blood pressure monitor. Check your pressure in the morning and evening for the first week of any new medication or dose change. Once you're stable, check it at least weekly. Keep a log. Bring it to your appointments. This data is incredibly valuable for your doctor to optimize your treatment. Some people have what's called white coat hypertension. Their blood pressure is fine at home but spikes in the doctor's office due to anxiety. Others have masked hypertension. Their pressure is fine in the office but elevated at home, which is actually the more dangerous situation. Home monitoring catches both of these patterns and gives you and your doctor the real picture of what your blood pressure is doing day to day. Now let me address some myths I hear constantly, because these dangerous misconceptions can prevent people from getting the treatment they need. Myth number 1. But doctor, my father lived to 90 with high blood pressure and never took medication. Why should I? The answer is survivorship bias. For every person who lives a long life despite untreated hypertension, there are many more who died from stroke or heart attack in their 60s or 70s. You don't hear their stories because they're not here to tell them. The data is overwhelming. Treating elevated systolic pressure saves lives, prevents strokes, prevents heart attacks, prevents heart failure and kidney failure. Myth number 2. I feel fine. My blood pressure is high, but I have no symptoms. Why treat something that's not bothering me? Because by the time high blood pressure causes symptoms, massive damage has already occurred. The stroke happens suddenly. The heart attack strikes without warning. You don't get a gentle warning from your body that your systolic pressure has been too high for too long. The first symptom is often the catastrophic event. This is why hypertension is called the silent killer. It doesn't announce itself. It works quietly, year after year, damaging your arteries, weakening your heart, setting the stage for disaster. Waiting for symptoms is waiting too long. Myth number 3. Blood pressure naturally rises with age. We shouldn't fight it. Treating blood pressure in older adults causes more harm than good. This is largely false. Yes, we need to be thoughtful about not dropping pressure too rapidly in very frail, elderly individuals, but the vast majority of people over 60 benefit enormously from blood pressure control. The HIVET trial specifically studied people over 80 with hypertension, and they found that treatment reduced stroke by 30% and death from any cause by 21%. Treating blood pressure in older adults doesn't harm them, it protects them. So let me bring this all together with clear action steps. If you're over 60, here's exactly what you need to do. First, know your numbers. When was the last time you checked your blood pressure? If it's been more than a month, get it checked this week. If you don't have a home monitor, buy one. They're inexpensive and widely available. Second, pay attention to your systolic number specifically. If it's above 130, especially if it's above 140, you need to talk to your doctor about treatment. Don't let anyone dismiss it just because your diastolic is fine. Isolated systolic hypertension in someone over 60 is dangerous and requires treatment. Third, implement lifestyle changes regardless of your numbers. Even if your blood pressure is normal now, these changes will help keep it that way. Reduce sodium, maintain a healthy weight, exercise regularly, limit alcohol, manage stress, and get 7 to 9 hours of sleep. These aren't optional add-ons, they're foundational. Fourth, if your doctor prescribes blood pressure medication, take it consistently. Set alarms, use a pill organizer, make it part of your routine. Missing doses causes your pressure to swing up and down. which is actually worse than consistent mild elevation. Consistency is everything. Fifth, monitor your blood pressure at home and keep records. This empowers you and gives your doctor real data to work with. It transforms you from a passive patient into an active partner in your care. Sixth, never stop or change your medication without talking to your doctor first. I cannot stress this enough. Suddenly stopping blood pressure medication can cause a dangerous rebound spike. If you're having side effects or concerns, call your doctor. Adjust the plan together. Don't go it alone. And seventh, get regular checkups. Blood pressure control isn't set it and forget it. Your needs change over time. Your kidney function changes. Other medications get added. Your blood pressure medications may need adjustment. Stay engaged with your healthcare team. I want to end by bringing you back to Margaret, the patient who had that devastating stroke because her elevated systolic pressure went untreated. I think about her often, not because she was unusual, but because she represents thousands of people who are walking around right now with the same pattern: elevated systolic pressure, normal or low diastolic, thinking they're fine because one number looks good. If Margaret had understood what I've explained to you today, if she'd known that her systolic pressure of 165 was the real danger, if she'd insisted on treatment, I genuinely believe she'd still be independent, still gardening, still living life on her terms. But that knowledge never reached her. She trusted a system that didn't clearly communicate which number mattered most. Now, if you have any questions, leave a comment down below. I read every comment and share this video with someone who needs to hear this today. I will see you in the next video.